Scene script. Have you ever contemplated how dementia impacts lives? What are the repercussions of this cognitive disorder on our daily living? Dementia is often misunderstood as a specific disease. However, it's more accurate to describe it as a collection of symptoms that affect cognitive abilities, memory, thinking, and behavior. It's like an uninvited guest that takes over the house, affecting every room and changing the way you live. In the vast world of dementia, Alzheimer's disease is the most prevalent, like the biggest city in a country. It's responsible for the majority of dementia cases, making its name synonymous with the term dementia for many. But it's important to remember that Alzheimer's is just one type of dementia, one city in a vast country of cognitive disorders. Now, you might be wondering about Parkinson's disease. Is it a part of this cognitive country, or is it an entirely different land? Well, Parkinson's disease does share some borders with dementia, but it's not a form of dementia itself. It's more like a neighboring country with its own unique characteristics. But we'll delve deeper into that relationship in the next scene. Early detection is vital in managing dementia. Like forecasting a storm, the sooner you know it's coming, the better prepared you can be. Some early signs include memory loss, difficulty with tasks, confusion, changes in mood, and problems with language. Recognizing these signs can help in seeking early intervention and better management of the condition. Once the storm of dementia has been detected, it's crucial to manage it effectively. This is not about stopping the storm, but rather learning how to navigate through it. It involves a combination of medication, lifestyle changes, and a holistic approach. However, it's equally important to know what not to do. Certain actions or lack thereof can aggravate the condition, making the storm more destructive. Dementia is much more than just forgetfulness. It's an umbrella term for a series of symptoms that can drastically change a person's life. But remember, like any storm, it can be weathered with the right preparation and understanding. Let's delve deeper. Is Parkinson's part of dementia? It's a question many ponder. To clear the confusion, let's delve a little deeper. Parkinson's and dementia are indeed separate conditions, each with its unique set of symptoms and challenges. However, there is a link between the two. Parkinson's, a neurodegenerative disorder, primarily affects movement, but as it progresses, it can lead to Parkinson's disease dementia, a condition that affects cognitive functions, much like Alzheimer's and other forms of dementia. This doesn't mean everyone with Parkinson's will develop dementia. It's merely a possibility, one that reinforces the complexity of our brain and its diseases. The key is to understand that while they are distinct, they are not mutually exclusive. So, while Parkinson's is not dementia, it can become a part of the dementia family in certain cases. What if we could detect dementia in its early stages? What signs should we watch out for? These questions underscore the importance of early detection in managing dementia. Identifying dementia early on allows individuals and their families to plan for the future, make lifestyle changes, and seek treatments that may slow the progression of symptoms. But what are the early signs of dementia? The earliest signs of dementia often involve subtle changes in cognitive abilities. This could be as simple as forgetting appointments or misplacing items more frequently. It might also involve difficulty performing familiar tasks, such as cooking a meal or driving to a familiar location. Language problems are also common early signs. Individuals may struggle to find the right words in conversation or forget the names of everyday objects. They may also experience difficulty following a conversation or understanding complex instructions. Changes in mood or behavior are another early sign. This can include becoming unusually emotional, showing less interest in social activities, or behaving in ways that are out of character. For instance, someone who was once outgoing and sociable might become withdrawn and quiet. Disorientation and confusion can also occur. Individuals might get lost in familiar places, lose track of dates or seasons, or have trouble understanding something if it isn't happening immediately. It's crucial to note, however, that these signs do not definitively indicate dementia. Many of these symptoms can be part of normal aging or caused by other health conditions. Therefore, it's essential to seek a professional diagnosis if these signs are noticed. Remember, everyone's experience with dementia is different. Symptoms can vary greatly from person to person, depending on the type of dementia and other factors. Early detection is key in managing dementia. It allows for early intervention, which can help to slow the disease's progression and significantly improve quality of life. It also gives individuals and their families time to plan for the future, seeking appropriate care, and making necessary lifestyle adjustments. Being vigilant about these signs can be crucial for early detection and management of dementia. So let's keep an eye out for these signs, and remember that early detection can make a world of difference. Once detected, how do we manage dementia? Can it be controlled? This is a question that echoes in the minds of many affected by dementia and their loved ones. Dementia, while challenging, can indeed be managed. The management of dementia is multifaceted and involves medication, lifestyle changes, and a strong support network. Firstly, let's talk about medication. There are several types of medication that can help manage symptoms of dementia, particularly in the early and middle stages. These include cholinesterase inhibitors and memantine, which work by regulating neurotransmitters in the brain. These medications can help slow down the progression of symptoms and improve quality of life. However, it's important to remember that these medications don't cure dementia. They simply help manage the symptoms. Next, lifestyle changes can have a significant impact on managing dementia. Regular physical exercise, a healthy diet, and mental stimulation are all crucial. Exercise promotes brain health, a balanced diet provides essential nutrients, and mental stimulation such as puzzles or reading helps to keep the brain active. Sleep is another essential factor. A consistent sleep schedule can help regulate the body's internal clock, which can be disrupted in dementia. Furthermore, avoiding alcohol and tobacco, which can exacerbate symptoms, is highly recommended. Lastly, but possibly most importantly, is the role of a strong support network. Loved ones play a vital role in managing dementia. Emotional support, help with daily tasks, and the reassurance of a familiar presence can all help alleviate the stress and confusion that dementia can bring. In addition, professional help such as therapists or support groups can provide valuable coping strategies and a sense of community. It's also worth noting that every individual's experience with dementia is unique. Therefore, management strategies should be personalized to suit the individual's needs and preferences. While there is no cure for dementia, these management strategies can significantly improve the quality of life. Remember, dementia is a journey, not a destination. And with the right support and management, it's a journey that can be navigated with grace and dignity. Is dementia a life-threatening disease? Or can it be managed well with medication and a holistic approach? Well, the answer to both questions is yes. Dementia in its advanced stages can indeed be life-threatening. It can lead to severe cognitive decline that affects a person's ability to perform everyday activities, such as eating or walking. In some cases, it can also lead to physical complications like infections or falls, which can be fatal. However, this does not mean that dementia is a death sentence. With early detection and the right management approach, the progression of dementia can be slowed down. Medications can help manage symptoms and improve quality of life. A holistic approach involving cognitive stimulation, physical activity, and a healthy diet can also play a significant role. Moreover, support from family, friends, and healthcare professionals is crucial. They can provide the necessary care, ensure safety, and help maintain a positive and encouraging environment. Dementia can be a severe condition, but with the right approach, its impact can be mitigated. Could this condition lead to suicides? And if so, how can we prevent it? Dementia, with its debilitating symptoms, can sometimes lead to feelings of despair and hopelessness, increasing the risk of suicidal thoughts and actions. This is particularly true in the early stages when individuals are acutely aware of their cognitive decline. It's a harsh reality, but one that underscores the importance of emotional and mental health care in dementia management. Prevention strategies hinge on early intervention and sustained support. Regular mental health checkups, emotional counseling, and cognitive therapy can help manage feelings of depression and anxiety. It's crucial to foster a supportive environment where individuals feel understood and valued despite their condition. Medication can also play a role, but it's not a standalone solution. A holistic approach combining medical treatment with emotional support can make a significant difference. With proper care, support, and intervention, the risk of suicide in dementia patients can be significantly reduced. Dementia is a complex condition that affects millions globally. It's not a specific disease, but an umbrella term for a range of symptoms impacting cognitive abilities, memory, thinking, and behavior. Alzheimer's is the most common type, but Parkinson's too can be associated with dementia. Early detection is key, and recognizing the signs, memory loss, difficulty with complex tasks, confusion, can help in timely intervention. Once detected, managing dementia requires a multi-pronged approach, encompassing medication, lifestyle changes, and a supportive environment. It's crucial to remember that dementia, while a serious condition, is not automatically a death sentence. It can be managed effectively, and with the right care, those affected can lead fulfilling lives. It's also worth noting that while dementia can lead to feelings of despair, with appropriate mental health support, the risk of suicide can be mitigated. Understanding dementia is the first step towards managing it effectively and improving the lives of those affected.